Yeah, she takes the phone, goes right into the essentially the owner of this company and is like, this is what he just told me to do. That guy was like fired on the spot, bro. What? Never have I ever. We've done it with a fellow doctor, but this time I'm joined by a firefighter. Fire Department Chronicles in the house, baby. You ready? Let's do it. Boom. Never have I ever removed anything strange from a person's body. Oh, of course, you don't understand what I pulled out of my patient the other day. Okay, it was huge, huge, huge splinter. Wow. Yeah, kind of a buzz killer now. You don't like explaining. So, good thing in my field is anything that goes in the body stays in the body. We're not even allowed to take things out of people. Really? Yeah, if you're in the field, just in case there's tamponade from the, yeah, I've ran on guys with 3-foot lightning rods sticking out of their bag. They felt
What's a lightning rod?
like something that's on the side of a building, or this was actually, I'm sorry, this was a pole that was in the ground and he fell off the roof.
What?
Yeah, impal. Yeah, we cut it, bring him to the hospital. They do a quick x-ray. They're like, good, pull it out. Didn't even touch anything.
Wow, that's so scary.
Oh, I've had a bunch of kids with like Legos and stuff in their nose.
Oh, yeah.
I pulled that out. You know what you have removed from someone's body? Their soul. Another person. Oh, I delivered 38 babies.
38 babies?
Yeah, last week. Last week during my residency.
Jeez.
Let's go. Never have I ever been physically scarred on the job.
I was burned on my knuckles really bad from a fire.
Ooh,
Yeah.
you were punching it?
I was punching the fire and the fire said, "Not today, bro." And they punched me back. We were fighting a shed fire, a bunch of gas and stuff inside of there, super hot. We came out and I had second-degree burns on my knuckles that went through the gloves. Yeah.
The only cool scar I have on my body is, hold on, second. Which hand is it up? Do you see this on my hand?
Yeah, punching.
I fell on a train set when I was like 5 before coming to America, and it penetrated.
What kind of train set was this, bro?
Russian.
I was going to say it's got to be Russian.
Russian steel. Never have I ever dated a patient. No, I don't refuse to even date coworkers, let alone patients. Co-patient would be the worst. No way, dude. Yeah, I've never like gone on scene and been like, "Ooh, yeah, that's a good one." Like, no. No. Never have I ever been genuinely scared at work. Oh, yeah. Oh, yeah. I mean, holy. When was the most scared you've been at work? So we had a fire at a UPS or shipping factory, and the fire was in the middle of the entire factory. For stuff like that, it's producing enough smoke that it's banking down to the ground. We can't really see as we're going in there. So we can follow hose lines into where it's at. And I was about 3/4 of the way or quarter of the way into the building. And I ran into a bunch of like shipping equipment. And in that moment, I was like, if this building collapses or something happens because there's so much smoke around me, you won't even know. Yeah, it's going to be so difficult for me to find my way back out of this before everything collapses. So that was probably one of the first times that I was like, I could actually die doing this. In those scenarios, is there any kind of dumb guy question that some kind of goggle you could put on that allows you to see through the smoke? They're trying to develop stuff like that, but we do have right now, we need more dumb guys asking good questions, man. We would solve some. We do have thermal imaging cameras. So we carry around thermal imaging cameras, which allow you to see a door if it's hot or no. We can see through the smoke with that. We can't see that, yes, but it's just not built into our masks. I wasn't scared for my life, but I would have raised my hand on that. When you're on your first night shift, or one of very few first night shift as a resident, and you're the senior, everyone admitted into the hospital, with the exception of the ICU, is under your care. So any page about any patient comes to you. Any rapid response, meaning some medical scenario starts happening with a patient, comes to you. Any code blue is run by you. Anyone that comes into the ER that needs to get admitted into the hospital is on you. And it's just you and your junior resident who doesn't know much, who's just there basically helping you out. So there were times when you're like 4 admissions, 2 rapid responses, code blue, you're trying to juggle all this stuff and you're not doing it perfectly, but you're just doing enough to stay afloat. Yeah, I've dropped off a couple times at hospitals where there's 2 nurses. I mean, very large facility. Like it's 2 nurses and 1 physician, and there's, 15 beds. Like, this is crazy, man. That to me is genuinely insane. That's why we have emotional support animals in the hospital. Not for the patients, for us. Never have I ever seriously considered quitting my job. Nope. You did. Yeah, there was a time where I was stuck at a station with a crew that I did not like. Oh, and for a long time, for a year and a half, the calls we were running 19, 20 calls a shift, just getting blasted. I was getting no sleep. And then, why? You drank on the job? No, I didn't drink on the job. You said you were getting blasted. Oh, sorry. Maybe that's different. Some people, we were getting beat up. What made them bad? You are with someone for 24 hours, and imagine their personality types aren't the same. You don't vibe on the same stuff. You don't watch the same TV. So it's not that they were evil. No. One of them was, but say his name to the camera. Yeah, I should call, so he knows. Never have I ever had equipment fail when I needed it most. Oh, I have such a bad one. You won't be able to empathize. You'll be able to sympathize. I don't know which one is right, but it was a speculum. Are you familiar with what a speculum is? So I'm about to perform a pap smear. And as I take it out, and technically you're not supposed to use lubricating jelly on speculums when you're doing a pap because it could interfere with the results of the pap. But if you do put it on a specific part of the area that doesn't make contact with the cervix, it could be okay. Mm-hmm. So as I'm putting it on, I realize that this plastic speculum has a beveled, broken edge, so that if I went to insert it, it would just slice right through the tissue.
Holy crap.
Can you imagine what that would have been like?
No.
I'm glad you saw that. And it was because I kind of touched the edge and I was like, oh. We filed a complaint with the manufacturer, a lot number, huge investigation happened. So, holy crap. But imagine just because it was razor sharp, thick plastic when it slices right at that angle. We were on a fire and I'm pumping this fire from the engine, and we're pumping one of the hoses. They say we need a second one because the fire starts. You say pumping. I don't know what actually that. Oh, sorry. So is that opening so when we pull up on fires, we have a pump that's inside of the fire engine that we turn on through what's called a PTO system. And it spins and it's pushes the water out at the pressure. So it's just a button, or like, are you man? No, I have to pull open tank to pump is what it's called. And then the engine spins and then it pushes out through discharges. So I'm pumping one of those out. Everything's fine. They say we need a second line, a second hose, because the fire's spreading. So we go to pump the second one, and the pump just starts to fail. So there was an issue with it. There was a hole in one of the intakes, and it was pulling in air, so it wasn't a sealed system. So both of these, like a pneumothorax, but inside of it, that's what we were screaming. We were like, it's a new, oh, I was about to say sick, too much. We got a pneumothorax. It happens with people. Not even the hoe in the hoses. If there's no hydrants available, like you live in an area where there's enough hydrants, you think about this. You go to rural areas, they don't have hydrants every single. You have to start bringing water tenders. We have big tanks. We start bringing in water, and they'll pump out of the water tender into. Is it true that if a car is parked at a hydrant, you just go through the window? Yes. If they're parked in front of our only hydrant, we're going to go through your window. Yeah. Never have I ever been blamed for something that wasn't my fault. Oh, I got a really good one. When you're a med student, a lot of times you're sent into the exam rooms, especially in the ER, to interview the patient and then present to the junior resident, who then interviews the patient, presents to the senior. And I would go in, talk to the patient, ask some pertinent questions that are important to the case. They would answer them. I would go present it. And then when the resident would go in, they would tell a different story. And the resident would be like, bro, like, you shouldn't lie about what you asked. I'm like, are you kidding me? And I wanted to take the person and be like, tell them the truth. I asked you this question. And that happens. And I don't know if they misremember or they feel something different or they perceive the question differently, but it happens all the time. No, that happens to us when we're dropping on patients. Yeah, we'll get them in the back of the truck, like no anticoagulation. And the patient's like, Lavix. Yeah, they come in every day like this. So that happens all the time. We'll sit there, no medical history. I don't take any meds. All right, cool. We'll drop them off at the hospital, and they'll just start listing things off. And the doctor's like, what are you doing, man? I swear to God, mine. Never have I ever had someone refuse my help when they really needed it. One of my favorite things ever was we show up to this lady, and she says, hey, my husband needs to go to the hospital. I'm like, sure, you want to go to the hospital? I don't want to go to the hospital. Like, come on, you should go to the hospital. She's saying she's like, his foot, he's got to go. He's like, I'm not going, I'm buying. All right, fine. Can you just look at his foot before you leave? Because we're not allowed to take people. It's kidnapping, that kind of thing. I was like, all right, fine. Isn't kidnapping, if someone says, I do not want to go to the hospital, they're alert and oriented, then we're not allowed to take them, assuming they're not a danger to themselves or anything like. But isn't, like, if they're sick and you think they need to go, is that a danger to themselves? I mean, what are we talking? Like their leg hurts? It's gangness. Yeah. So I go to look at his foot. You can see right through his heel to the bone. Like, you can see the bone. I was like, deep DQ. Oh no. I was like, dude, you need to go to the hospital, man. And he's like, really? You think I need to go? I was like, oh my God. So probably diabetic scenario where he's burned off his nerves, because in diabetes, you have high sugar levels in your blood, which can impact inflammation levels, damage these peripheral small nerves that give sensation to your lower extremities and your fingers, which is why uniquely in diabetes, there's a scenario called hand stocking syndrome, hand-foot stocking syndrome. And it's like you lose sensation in your hands and feet because of the diabetes. When we got him in the rescue, he was like a super cool dude. He's like, I guess I should go, man. I'm like, yeah, so he did go. You're about to die. Yes. No, so at that point, I'm like, you're going to the hospital, just so we're clear. You got to go, dude. I had a patient similarly, also foot, come into our office and was just recently hospitalized, left AMA against medical advice. And now I'm seeing him. And his wounds, he has really bad lower extremity cellulitis worsening since he was there, didn't take any of the follow-up medications. And I worked so hard to try and not convince him, but explain why the need for him to get IV antibiotics was so important. And he was negotiating to me as if he was so flippant about his life. Like, well, if I stay like this, how long do I have? Oh my God. And I was like, I can't say with any certainty, but you're putting yourself at unnecessary risk. And he was unhoused. So he was worried about his one car that he lives out of. Where can he park it? I got him free parking in the hospital. He was very worried that they wouldn't allow him activity to walk around. He would be subjugated to sitting in his bed. I made sure that the resident that would admit him would put activity orders, that he would get out of bed with assistance. Like, we try to do everything. And he said he was going. And I checked the next day, didn't go. Never have I ever worked a 12-hour shift without food. Oh, so I definitely have. Yeah, of course. I've gone 18 hours without eating on a shift, right? I'm sure you have too. Yeah, I've definitely gone long periods of time where I'm not eating. When we go to the hospitals, they're cool. They have EMS rooms. So they'll have little snacks, something I can throw in there real fast, but definitely not a proper meal. No. That's a big thing I hear from a lot of nurses is like they just don't eat for 12 hours or 16 hours. Like, that's crazy. Never have I ever yelled at a coworker like Dr. Robbie on the pit. I yelled. Yeah, I yelled. You yelled at somebody? You strike me as such a nice guy. So calm, chill. God, you're the first person to ever say that. That's insane. We were arguing about something that happened on a call. Neither of us are very happy about it. And once I start rolling, I become quite passionate. Well, passion is good. Yeah. I got into an argument with one of my nurses. She's been on this channel. She's awesome. Her name is Nurse Jenny. She's been a nurse for 175 years. Oh, nice. And I asked her to order an EKG because in looking at the patient's labs, they were hyperkalemic, elevated potassium, and I needed to make sure that there was no arrhythmia. As a result, she assumed that I was saying that the patient had chest pain and needed an EKG, and was like, the patient has no chest pain. I'm not ordering EKG. Leave me alone. I'm busy. And I was getting really mad. I said, you don't understand why I need an EKG. I need an EKG. She's like, you're always bossing me around. I'm not getting an EKG. You don't need the EKG. There's no chest pain. And then my boss came in, he settled, and we're okay. Oh, that's good. Yeah. But we had that mom-son relationship. Yeah. Where she was my mom. I wasn't her mom. Never have I ever thought a coworker should be fired. I think at all points in time and some point in time. Say the coworker's name. Let's get them. Let's get them out. Let's get them out. When I was a med student, I was rotating through all sorts of different medical hospitals and clinics, and I remember I was on my surgery rotation. And I was scrubbing into a procedure. I believe there was a small tumor identified in the chest cavity, and we were going in to take a biopsy of it. And the chief resident was in the room along with the attending, and they started operating, and they're being very casual. All of a sudden, the resident goes, and the surgeon goes, "What?" He goes, "I think I may have nicked the heart." And everyone freaks out. He's like, no, you didn't. No, you didn't. Step over. No, you didn't. And they're like, you can't really see. It was really bad access. So they're feeling with their hands. They can't tell. Blood's pouring out. We can't tell if it's just a bleeder or he actually nicked like the pericardium. So we're freaking out. No one knows what to do. And he's like, that's it. Crack him. So right then and there, crack the side of the ribs, open up the chest fully, convert it to open. Turns out it was just a little bleeder, didn't nick the heart. And here's where the bad part is. Because everyone's allowed like an error. That's human error. It's part of the risks of going for the procedure. The chief resident was really upset. And the surgeon very arrogantly goes, what are you upset about? This guy works for UPS. You get disabilities. You should be chilling. Oh. And I was like, wow, man, you lost your humanity. Like full on gone. You see people get burned out in the medical field or in all fields, but, and it's a sad day to see that, man, just to lose that humanity. No, I had a supervisor. I was working for an ambulance company, and the supervisor decided he could control the overtime and when people could get it or not. So this girl comes in. She says she wants the overtime or wants to be on a specific truck. And he says, okay, here's my phone. You go in the bathroom and figure out what you want to do with this phone. And if the pictures are right, then I'll give you that. That's what, yeah. So good news is she takes the phone, goes right into essentially the owner of this company and is like, this is what he just told me to do. That guy was like fired on the spot, bro. What? But like that means if that comfort level was there, he's doing that before.
Oh, yeah.
Yeah, just openly like, here you go. But I'm glad she went right into the person that owned it. Cheers to her for standing up for herself. Never have I ever laughed at work when I probably shouldn't have. Yes, that's daily. That's I think dark humor is where that falls in, of course. Yeah, the healthcare humor is the darkest. I had a lady cut in half from a vehicle.
Oh my God.
So you show up there and you're like staring at like your brain doesn't even process what you're looking at. She was halfway there. Yes, that was hit by a car, hit a pole, cut in half, and you're like, what? Like it's insane what your brain will do.
Yeah.
And where it won't allow you to process that. Like this can't be real. There's no way. And just getting back, and that was actually, that was my third dead person for the day. So, and you're having 20 calls in that.
Yeah.
So I got back and I was like trying to write the report, and my captain was like, you good, bro? Like, I was like, then I'm alive. We both just start laughing, and that was the end of the day. So you have to maintain your own sanity, find space in dark, otherwise dark places. That's very understandable. Yeah, like I've had patients tell me a dark story, and the way that I have a good rapport with the patient, and they tell me a dark story that like they should not be telling, as sarcastically and flat as they are. Yeah, and it made me laugh, and I apologized to the patient. I go, no, I still laugh at this too. And they're telling me something tragic, but we both found some humor in it. I'm like, I shouldn't be laughing. And he goes, I know I shouldn't be laughing. And I explain, I'm like, the reason I'm laughing right now is because of the way you're presenting it. And they go, no, I totally get it. So thank God I learned a lot about firefighters. But if you want to learn some more, click here to check out my reaction to Chicago fire. As always, stay happy and healthy. Thanks for everyone.